Injection site abscess. Your skin is the layer you can see just below your skin. Before, the skin has 3 layers, but that whole thing is thin. Just below the skin, there's fat. And just below the fat, there is muscle. So if you push, so picture what I said in your head now. There's one thin layer of skin, then there's fat under, fat, and then there's muscle. If an injection is supposed to be IM, intramuscular, whoever is giving you an injection is supposed to almost bury the entire needle inside the muscle. So you're supposed to go through the skin, the fat, and go to the muscle and go inside. So if this is the muscle, level of the muscle, and the fat is here, in this air column over my hand, and then the skin is somewhere here, you're supposed to go through the skin with your needle, go right all the way through, get to the muscle, go in, and then pour the drug here. So when you pour the drug here, the muscle is rich in blood supply. So of course the blood supply. What I mean blood supply again? Those piping arteries and that are there that bring blood to that place, take blood away from it. A lot of blood communication happens on like the muscle. You just collect the drug as well and move it into the circulation. But sometimes drugs are chosen to be given in the muscle so that it will now go into the blood slowly, because those pipes that come there will just collect it and be going, into the rest of the circulation slowly. But if somebody goes through the skin, a healthcare provider gets to the muscle and does not know that he has not got gets to the fat and doesn't know that he has got to the muscle and then pours the drug here, that's what causes abscess. The drug will now come and sit on top of the muscle inside fat and just be irritating the top of the muscle, be irritating it. So you're feeling pain from, of course, somebody bridging the skin. You're feeling pain from drug irritating the top of the muscle. And then there's fat. And then there's the drug. The whole thing becomes a mess. And then it forms, of course, it creates some injury on the muscle tissue. The components of the blood that help you fight infection, that helps you fight foreign things will come there. The place will become very busy, to become very messy, and then it forms injection site abscess. So this will happen sometimes to girls who have very fatty glutes or buttocks. So if the provider does not understand what's going on, you will think you're about to the muscle, and then you're in fat, and then you pump it there. I can create injection site abscess. When you finish taking injection, that place swells up, and from there they start tearing you, trying to drain it, start dressing it. The place becomes a whole mess. So I'm not saying you should give yourself injections because I've shown you how it's done. I'm saying you should probably show your provider this video the next time you want to get an injection, or show them a day before, send it to them to watch it before you come to their place, so that just in case they forgot. These things, we are all trained to know this already. Just in case somebody forgets, this is a reminder. And then for you, if you suffer that problem, so you have an idea of what happened. The purpose of this channel and some of these videos you see is to teach you what is going on with your health, to teach you what your doctor is doing for you, or what your doctor wants to do for you, that he may not have time to explain because of the queue most doctors have to deal with. So sometimes these explanations don't come. They are supposed to come, but if you sit and explain for 5 minutes, don't know how long this video has been, or 4 minutes per patient, then you now start finding, of course, you're supposed to get information from the patient, first of all. Then attempt to solve the problem. Then you now sit and explain 5 minutes again. If I end up spending some time with one patient, and then it depends on what the queue is. And usually the patient doctor ratio is usually off most good centers. So this page is dedicated to explain as many medical concepts as possible. In vitro fertilization, fertility, sexual discordance, erectile dysfunction, everything. What do you call it? I don't know. Cosmetic surgery. Just looking at all the aspects of health. We attempt to do our best with covering. So if you have also areas of question, you have questions you want me to answer, you're going to have to call me. There's a WhatsApp number attached to every video you see. So find where the WhatsApp number is. Some of it may be popping on the screen. Some of it will be in the description or in the caption, whatever is down, wherever it is you got the video. Just get into that WhatsApp. If you the moment you text me in less than a minute, you'll be on the call with me. But it's not free anyway. You're not going to be able to access me free of charge. But you can get access to me in real time if you're interested in talking to me. Whether you want me to talk directly to a parent or a relative or somebody you care about, or you want me to talk to you directly about something, or you have a problem you want me to help you solve directly, you can reach me via the contact somewhere. Always look for it. You find it. Check the description, check the title, check. You'll see sometimes on the screen too. And text me.